I want to give you a picture of where I'm sitting. I'm in New Hampshire. We are now the number one state with the highest number of infections per 100,000. If you look at the 7-day data, average data. So, and what I would tell you is it's almost like there are parallel universes here, right? You have, I think it's safe to say, when the vaccines came out about a year ago and millions of Americans started to get their shots, I think everybody was breathing a sigh of relief. We're finally going to get to shut down this virus, as President Biden promised during the campaign, although it's a very dangerous thing to promise. And then in spring, early summer, things seem to be getting better. People could get vaccinated, people could get together without wearing masks. And then the Delta variant hit, and then cases were on the rise again, hospitalizations, deaths. Then boosters came out. So people got more hope with the boosters. And now we have a new variant. But I think people are very, very tired. There's a fatigue with this. And there's two reactions to that fatigue. Some people want to just be done with this, and they just want to go back to having fun again. And I see them all over the place here. They're not wearing masks when they go to the store. They're crowding bars and restaurants. They're going to indoor concerts with thousands of people not wearing masks, having holiday parties with all kinds of people. And then it's almost a parallel universe. Then there are those who won't leave the house unless they're double masked. They will not get together with people they don't know or are vaccinated. They're not going to restaurants or bars. They're not doing concerts. And it's almost like we're back in the early days when we had no vaccines, and they're staying in their homes. So I guess my question to you as an epidemiologist is, so which is it? What should we be doing?
Well, I wish we were all in lockstep a bit more together. If we were, we would be in a better place. It is the fact that we are not coalescing around the idea that my infection is important to you and your infections are important to me, and that we're all in this together. That's why we're still battling this. And that's why the United States consistently is having the highest number of cases per population in the world. We have not gotten into this together and realized that this is a community event, that we all need to be watching out for each other. And that's sad. I will say that's very sad. I'm super tired of this virus, but it doesn't mean the virus is done. And frankly, us being tired of it and pretending like it doesn't exist is the reason why we still have so much of it in the United States. We don't need to be in a lockdown situation. We're way past that because of our vaccinations, but we could be in a much better place if we had higher levels of vaccination. We also could be in a much better place if we continued with some of our public health preventions that we know work really well against this virus. We know that masking works. We know that not being in crowded situations with people who are not yet vaccinated is safer. We know that outdoors is safer. So I think as we see cases going up across the United States again, this is not Omicron that we're seeing. We don't have enough of it here yet for this to be the reason we're seeing numbers go up. This is still Delta that we're fighting with. And we're going to be an interesting experiment in the United States to see if Omicron takes over Delta, because in South Africa, there wasn't very much Delta to take over. So that is why Omicron is exploding there. If we should hope Omicron is more mild, even if it's more transmissible, and then we will want it to take over Delta, but we just don't know that yet. But what we do know is that we are suffering from Delta in the United States. And yesterday we lost 1,660 people who died of the Delta variant in the United States. And everyone who's dying has a very, very strong likelihood that they were not vaccinated. And those who are dying who are vaccinated are older and have underlying conditions that put them at increased risk. And so we just need to recognize that we've got some tools to fight this. And if we all got in this together, we would not be doing this forever.